Ladies and gentlemen, please welcome the President of the Hebrew University of Jerusalem, Professor Asher Cohen.
Hello and welcome to the Titans of Global Health. As President of the Hebrew University of Jerusalem, I am delighted to be part of this event honoring Drs. Anthony Fauci, Leonard Schleifer, and George Yannakopoulos. The work of today's honorees spans decades of scientific work and public health initiatives, including the current coronavirus. I think everyone will agree that the coronavirus pandemic serves as a timely reminder that our health and welfare is intimately connected to improving the health of people throughout the world. The Hebrew University is noted for interdisciplinary research that can spark innovative solutions to some of today's most challenging problems. HU has long been a world leader in medical research and innovation. Our tradition of collaboration between disciplines and institutions has not only yielded great discoveries, it has also earned the Hebrew University a reputation for global leadership and cooperation. That cooperative spirit is central to the work of the Kuvin Center for the Study of Infectious and Tropical Diseases and essential to the new era we find ourselves in. The eyes of the world has been opened to diseases that spread without warning, without caring about borders or ideologies or bank accounts. How will we overcome these deadly threats that cannot be reasoned or bargained with? How can we prevail both today and tomorrow? Today, we celebrate scientific leadership that has reached around the globe to help comfort and protect us all. We also highlight the impactful research being performed every day by the faculty, trainees, and students of the Kuvin Center for the Study of Infectious and Tropical Diseases. Proceeds from this event will go to further this great work at HU's Kuvin Center and its American friends. I want to express appreciation to each of you for your generosity. Your contribution makes you a part of our family of friends who share a concern for improved health for people throughout the world while helping to prepare us for the healthcare challenges that lie ahead. Thank you. And now, it is my honor to introduce a man whose calm, scholarly demeanor was able to cut through the chaos and fear as the pandemic spread, who gave us a much-needed voice to science as we struggle to keep ourselves and others safe in the midst of a deadly and invisible viral threat. Ladies and gentlemen, it is my privilege to virtually present the Maimonides Award to Dr. Anthony Fauci, Director of the U.S. National Institute for Allergy and Infectious Diseases. The Maimonides Award is one of the highest honors bestowed by the American Friends of the Hebrew University. It is reserved for individuals who have not only excelled in their field, but whose caring endeavors and commitment have contributed to the betterment of humanity. Maimonides' prayer, which rivals the Hippocratic Oath in influencing medical ethics, states, "Thou hast endowed man with wisdom to relieve the suffering of his brother, to recognize his disorders, to extract the healing substances, to discover their powers, and to prepare and to apply them to suit every ill." Dr. Fauci, on behalf of the American Friends of Hebrew University and the world at large, I am honored to present you with this well-deserved award and look forward to the time when you can visit us in Israel.
President Cohen, Ambassador Gall, Dr. Arkin, my fellow awardees, Dr. Schleifer and Yankopoulos, and distinguished colleagues and friends. It is with gratitude and humility that I accept an award named after one of the greatest of physician humanists, Moses ben Maimon, better known as Maimonides. Even though I cannot be with you in person, it is especially meaningful that I join you virtually at the Hebrew University and its Sanford F. Kuvin Center for the Study of Infectious and Tropical Diseases, named after my friend Sandy Kuvin, who himself exemplified many of the virtues and skills of Maimonides. Maimonides was both a philosopher and a physician who espoused the teachings of Galen, considered the greatest physician of the Greco-Roman era. Indeed, Maimonides studied and brought into his era, in the 12th century, the nearly lost ideas of Galen. Among many other things, Galen believed strongly that physicians should also become philosophers and humanists. He even wrote a book about it, that the best physician is also a philosopher. More than a millennium after Galen's death, Maimonides pursued Galen's example, integrating medicine and philosophy in new ways that still guide us today. Maimonides taught that as human beings and as practitioners of the healing arts, we must be humble and we must live our lives and practice our art to serve others. He taught that we must respect the dignity and worth of all human beings, and that we must serve not only individual patients, but all of mankind. Practitioners of the healing arts all around the world have been following the teachings of Maimonides for nearly 1,000 years. Many have been inspired by what we call Maimonides' daily prayer of a physician. This prayer, written by a German scholar more than 200 years ago, expresses the timeless teachings of Maimonides, asking that we pledge ourselves to helping others. It has guided many of us to a life of service and love for our fellow human beings. Sandy Kuvin clearly was committed to walking in Maimonides' footsteps. Sandy cared about people, and he cared about the world we live in. At NIH and later in other pursuits, he threw his energies into defeating the deadliest diseases that affect those who are less fortunate, notably malaria, among the greatest global killers of poor children, and later HIV/AIDS, the deadly modern pandemic that began by targeting some of the most marginalized human beings. Like Maimonides, Sandy traveled far and wide. He considered his home to be the entire world and all its people, and he served them well. Later still, at the Kuvin Center, Sandy and those he taught and mentored attacked a host of other important infectious diseases, wherever they cause suffering and loss of life, including leishmaniasis, schistosomiasis, and dengue fever. In serving mankind, as Maimonides has taught, Sandy believed that cooperative science is a key to peace, not only in the Middle East, but around the world. International students and researchers, mentored and inspired by Sandy, continue to come to the Kuvin Center to learn, to collaborate, and to advance science. They are now carrying forward his work in attacking new diseases such as Zika and COVID-19. In doing so, they honor Sandy and the noble ideals of Maimonides. It was my privilege to have known Sandy and to have witnessed his good works and his inspiring humanity. The Kuvin Center reflects Sandy's commitment to ridding the world of deadly and debilitating infectious diseases, and in particular, the so-called tropical diseases, many of which we now call neglected diseases, because many of those who suffer most from them are indeed neglected people, living in poverty and without resources that we, in the developed world, take for granted. In accepting the Maimonides Award, I thank all of you for keeping alive the great and good works of Maimonides and of his modern-day disciples, such as Sandy Kuvin. I thank you for bringing their humanitarian ideals to new generations of scientists and medical practitioners who now will, in their own careers and teachings, continue to make the world a better place.
Thank you, Dr. Fauci. It is truly an honor to have you join us. Cannot thank you enough for what you've done for the American people over so many decades. Thank you, sir. And to everyone joining us today, thank you for being here and for your support for Hebrew University and the Kuvin Center. For those who don't know me, I'm Stan Bergman, the chairman and CEO of Henry Schein. Henry Schein is the world's largest provider of healthcare solutions to office-based dental and medical practitioners, and we've been a long-time supporter of the Hebrew University. Among our collaborations with Hebrew University was the Bridge to Peace initiative, which brings together dental students and faculty from Hebrew University and Al-Quds University around serving oral health care needs of the diverse populations in the region. And later this year, I'm looking forward to returning to Hebrew University's campus to participate in the honorary doctorate ceremony. So tonight, I would like to express my delight and that of Marian's too. To joining this event, we will be honoring our dear friend Len Schleifer and his long-standing business partner, George Yankopoulos. George and Len are truly remarkable scientists and entrepreneurs, as you'll be hearing later. They literally started this business from scratch. Regeneron, a remarkable contributor to the health of the world's population. Our careers and personal interests often interact, as they do again here around Hebrew University. Hebrew University, by the way, brings together people from so many walks of life, a remarkable institution. I would also like to recognize Len's spouse, Harriet Schleifer, currently the president of the American Jewish Committee. Harriet and I have worked on many projects at AJC for over a decade, and of course greatly respect Harriet's tremendous leadership skills as she leads AJC during this most challenging period in its history. As co-chair of this event, on behalf of Mary and I would like to convey a heartfelt congratulations to you, Len, and bravo, George. This is a tremendous honor, and the American Friends of Hebrew University could hardly find more deserving honorees. Thank you for accepting the honor, and thank you for your remarkable contribution to science and to the world in general. It is also my esteemed privilege to introduce Ambassador Yossi Gal, who incidentally presented the Mount Scopus Award to me in 2016, and will now bestow this distinct honor upon Len and George. Ambassador Gal is a renowned statesman who strengthened Israel's relations with the European Union while serving as Director General of Economic Affairs. He has represented Israel in peace negotiations with Jordan and the Palestinian Authority. Ambassador Gal also served as Israel's ambassador to the Netherlands, and then later as ambassador to France and Monaco. The French government was so appreciative of Ambassador Gal's work that he was named a commander of the Legion of Honor after his ambassadorship of Israel to France and Monaco concluded. And so, without further ado, please welcome Ambassador Yossi Gal to present the Scopus Awards to Drs. Lenny Schleifer and George Yankopoulos.
Thank you, Stanley, and welcome, friends. George and Len, it is great to be here with you from Mount Scopus in Jerusalem historic home of the Hebrew University. The COVID-19 pandemic has illustrated the important partnerships between academia and public and private industry. It has shown how basic research opens new pathways to create advances in the development of new patient treatments. The pandemic has also highlighted frontline healthcare workers' compassion, skills, and dedication. They have become the world's heroes. Behind these heroes stand the scientists who are working from bench to bedside, creating effective testing, treatments, and prevention. That is why today dedicated scientists at the Hebrew University continue their critical research into the prevention and treatment of COVID-19. They are part of a worldwide effort, both in the public sphere and private industry, who are leading the fight against the coronavirus.
Together, Doctors Leonard Schleifer and George Yancopoulos have worked for over 30 years to build the biotech company Regeneron from a tiny startup into a powerhouse with a market cap of more than $50 billion.
Dr. Schleifer, who is a licensed neurologist, has been recognized as one of Barron's best CEOs and named Entrepreneur of the Year by Ernst & Young. Dr. Yancopoulos, who serves as Regeneron's Chief Scientist Officer,
is the principal inventor of the company's 9 FDA-approved medicines, as well as its foundational technologies.
Through Regeneron's effort to create better, more effective medications, Dr. Schleifer and Dr. Yancopoulos have remained steadfast in their commitment to develop medications to solve the human body's most complex mysteries. We are proud to honor their dedication to science and humanity through the presentation of the American Friends of the Hebrew University's National Scopus Award. The Scopus Award symbolizes the aspirations and the high ideals that led to the founding of Hebrew University in 1918 by giants like Albert Einstein, Sigmund Freud, and Martin Buber, and is presented to individuals whose professional and personal achievements have been of extraordinary benefit to humanity. Ladies and gentlemen, on behalf of the Hebrew University and the American Friends of the Hebrew University, it is my great honor to present the National Scopus Award to Dr. Leonard Schleifer and Dr. George Yancopoulos, and I hope to be able to host both of them personally in Jerusalem as soon as travel is permitted. Thank you.
Thank you, Yossi, and thank you to the American Friends of Hebrew University for honoring us with the Scopus Award. When I told my wife of 45 years, Harriet Schleifer, that I would be receiving this award, she kind of nodded as she was very busy doing her work as the president of the American Jewish Committee. When I mentioned that I would be receiving the award with a Greek and an Italian, both having grown up in the boroughs of New York City, as both Harriet and I did, she actually paused what she was doing and looked up. When I got her attention and asked her whether in her wildest dreams she ever thought I would be receiving an award with Tony Fauci and George Yancopoulos, Harriet smiled and said that none of us were in her wildest dreams. So much for spousal affirmation. We would like to thank everyone who generously supported this event to raise funds for the Hebrew University's Kuvin Center. I would personally like to congratulate Dr. Fauci for his recognition, which is certainly very well deserved, given his incredible contributions over the last year and throughout his esteemed career. It is not easy to do science and public health on a 24-hour news cycle timeframe in the midst of a presidential election and where millions of lives are at stake. Well done, Tony. Growing up, my father would tell me that you do well by doing good. At Regeneron, this mantra of doing well by doing good has helped us tackle many serious diseases, from devastating rare illnesses that impact only hundreds of patients to ones that impact many millions. We now have 10 FDA-approved or authorized therapies. These include important treatments for vision-threatening eye diseases, allergic and inflammatory diseases such as atopic dermatitis and asthma, and the first medicine approved for 2 advanced and deadly types of skin cancer. In the same commitment to doing well by doing good that drove our team's heroic efforts on COVID-19, our team applied their significant technological, scientific, and operational expertise to COVID-19 to bring a powerful medicine known as REGEN-COV to patients in a record 10 months from inception to availability. I know you'll hear a lot more about that from my partner, George Yancopoulos, shortly. As I'm sure is the case with all of us, I'm sobered by the enormous impact the COVID-19 pandemic has had. Nearly 100 million people infected globally and several million dead. It has touched each and every one of our lives. Despite this unprecedented public health crisis, the time has been inspiring in many ways. We have seen the power of science and resilience of people around the world, particularly healthcare workers and scientists battling this pandemic, and the essential workers who have kept us going along the way. Although we are very encouraged by the progress with the vaccine rollout in the United States and Israel, I urge us all not to forget the people still getting sick today all over the world. Now that our therapy, REGEN-COV, has compelling data proving its effectiveness and is strongly endorsed by our top governmental scientists and is free to people in the United States, we see it as a moral imperative to ensure people are treated. It's the right thing for these individuals, and it supports society by reducing the burden of hospitalization and death, which in turn supports economic recovery. While this award celebrates leadership during a pandemic, I don't believe the war is won yet. And you have my word that people at Regeneron will keep at it every day. And I ask citizens of all countries to continue to incentivize and reward innovation. Without that, the amazing vaccines and treatments that the biopharmaceutical industry has produced in record times, it is impossible to imagine the situation we would be in today. These miracles and the industry scientists who produce them need your ongoing support. Thank you for this honor. While it's a great honor to receive this award, it's a special privilege for me to pass the virtual podium over to Dr. George Yancopoulos. George and I have spent the last 3 decades working together to build Regeneron. It is George's genius, his technological breakthroughs, and the 10 drugs he has invented thus far that have truly made the difference in the health of countless people the world over. I am proud and privileged to share this award with George. George?
I echo Len in thanking the American Friends of Hebrew University for this award, in congratulating Dr. Fauci on his well-deserved recognition, and in acknowledging the researchers of the Kuvin Center for their tremendous contributions to human health. As Len noted, this pandemic has impacted us all. One silver lining to the overwhelming tragedy is that it has shined a light on the importance of scientific innovation and the need for our society to collectively support a robust biopharmaceutical ecosystem. Over the last year, the world has marveled at the seemingly miraculous speed with which treatments and vaccines against this virus have been developed. I want to highlight that it was indeed miraculous, but these miracles were actually born many decades earlier and depended on long-term commitments and investments to innovation and new biotech approaches, long before anyone knew they might be applied and needed. The 2 initial vaccines available here in the United States were based on mRNA technology that had never been used in a vaccine before, but scientists were quietly working on this technology for over a decade, so it was ready when we needed it. Similarly, the the technologies we used to develop our RegenCov antibody cocktail were not available 10 or 20 years ago. We had to invent them and perfect them. Looking back, it was crucial that we had already pioneered our approaches to fight another infectious epidemic, Ebola. Our groundbreaking therapy was the first FDA-approved treatment of any kind for Ebola, based on data showing that it had saved lives in an NIH-sponsored trial conducted in the Democratic Republic of the Congo during the 2018-2019 outbreak. Early last year, we brought all of this technological and clinical expertise to the challenge of designing an antibody cocktail that would be effective in both treating and preventing COVID-19, and specifically designed it to withstand viral mutations that might arise. Fast forward to today. Large phase 3 studies of thousands of people have proven that RegenCov is an effective treatment for those already infected and suffering from COVID-19, dramatically reducing hospitalization or death by 70%. Moreover, in those not yet infected but at high risk of contracting COVID-19, RegenCov prevented symptomatic infections by over 80%, with over 90% protection after the first week. This could prove life-saving for the millions of Americans who are immunosuppressed and thus cannot respond to or be protected by vaccines, but who could be protected by our RegenCov antibody cocktail. This cocktail has received emergency authorization in the United States and several other countries, including most recently in India, where we hope it can help in the response to their devastating COVID-19 surge. I'm incredibly proud of our team and all their selfless work to make this breakthrough possible. This pandemic has hopefully reminded the world that science is the solution to many of the global existential threats we face. But we need to invest in it every day and long before we actually need it, because that is the timeline for innovation. And we need a thriving ecosystem of great academic researchers like those at the Kuvin Center, as well as those in government like Dr. Fauci and his team, as well as a thriving, productive biopharmaceutical industry. Len and I, and all of us at Regeneron, are tremendously honored to be part of this celebration. Thank you again for the recognition.
Hello everyone, my name is Shai Arkin, and I was given a task to tell you briefly about some of the exciting work that takes place at the Hebrew University. You know, the Hebrew University was founded to provide the technological, scientific, and cultural foundations for the emerging nation. Today, the fruits of its research benefit the entire world, so let's give a few examples just so that you get the taste of what we do, and we shall focus on the biomedical research. So, it was the late Professor Aharon Razin and Professor Howard Cedar, may he live to be 120, that gave us the foundations for the field of epigenetics. They have shown how chemical modifications of our genetic information actually allow different tissues to express different sets of genes. Howard likes to call these annotations. Another researcher that has transformed how we treat cancer was Professor Alex Levitsky of the Hebrew University. And in a seminal paper in the late 70s, he provided an entirely different and new route to treat cancer. No longer should we simply subdue every replicating cells, but rather let's have a look at what is defective in the cancer cells and target that directly. It's this work specifically that motivated the people that came up with Gleevec and many other drugs that have really changed how we treat cancer. But the Hebrew University is known also for its ability to transform basic research excellence into applications. And I'll give you just two wonderful examples. Professor Chezi Barenholz and his colleague from Hadassah at the time, Alberto Gabizon, came up with an ingenious way to make use of a very potent chemical, doxorubicin. They encased doxorubicin in a small lipid droplet called a liposome, and in doing so actually generated the first nanodrug ever approved by the FDA. Today it's used all over the world to treat ovarian cancer, and the compound is called Doxil. Another ingenious example from our biomedical researchers came from Professor Marta Weinstock-Rosin. Marta realized that there's a certain chemical called acetylcholine that is present in low concentrations in the brains of those that suffer dementia. So if only she could come up with a way to increase the concentration of this chemical, perhaps she could alleviate the symptoms of dementia. And that's exactly what Exelon does. Now, both of these drugs, Exelon and Doxil, sell all over the world every year for over $2 billion. And the reason that I use this number is to impress upon you that it's not just the residents of Jerusalem or Israel that buy these drugs. They benefit all the world. Now, another amazing invention that came from the Hebrew University pertains to what our grandmother used to say. She used to say that you are what you eat. Well, the Hebrew University is credited with bringing us cherry tomatoes. And it is the late Professor Nachum Kedar and his student at the time, Chaim Rabinovich, that came up with cherry tomatoes. And each of us all over the world that eats cherry tomatoes should say thanks to those two amazing researchers that have come up with something that has changed how we eat every single week. And lastly, even if these things aren't successful and you're still ill, don't worry. The Hebrew University is there to ensure that at least you get to the medical facility, to your doctor safely, because it is Professor Amnon Shashua's company Mobileye that has ensured that traffic accidents are reduced dramatically by being the world leader in autonomous driving and driver assistance technology. But there's one center that I'd like to focus because it shows exactly the vision of the founders of the Hebrew University, and that is the Kuvin Center. The idea of the late Dr. Sandy Kuvin was rather simple but ingenious. The idea was as follows. The mosquitoes that carry leishmaniasis or malaria don't recognize the border patrol. Therefore, if we are to ensure that such diseases are eradicated, Israel needs to work with its neighbors. Now, even more so, working with its neighbors will not only benefit us biomedically, it will also ensure that we build better bridges to ensure that we work far better with our neighbors. Because you see, when people work on leishmaniasis or malaria in Hamburg, in London, in New York, or in Tokyo, they do so because it's of academic interest. Here we do so because of necessity. And the Kuvin Center is a wonderful place that tackles these important biomedical problems as well as providing bridges to our neighbors. So that's just the tip of the iceberg. I invite all of you to come to the Hebrew University so you may see some more examples of the wonderful work that we do. Thank you very much.
My father, Sandy Kuvin, was a malaria researcher who worked at the National Institute of Allergy and Infectious Disease. He recognized the crucial need for dedicated research in infectious and tropical diseases because of the very real global threats they pose. This led to the formation of the Kuvin Center for the Study of Infectious and Tropical Diseases within Hebrew University's Faculty of Medicine in 1976. Over the past 5 decades, the Kuvin Center has become a globally recognized research and diagnostic center.
The Kuvin Center is one of the jewels of the crown of the Faculty of Medicine. People from all over the world, students, but also scientists and physicians are coming to study here.
When you work in a place where you have a lot of people from different parts of the world working together, it helps you think in a more constructive way, in a more open-minded way, and incorporate that into your work.
The mission of the Kuvin Center is to study and further understand infectious and tropical diseases. And we do that not only through great science, but through collaborative science. Everything from local collaborations within Israel to regional collaborations across the Middle East to collaborations literally in every corner of the world. And as my father said, that we can develop peace through science. It's all about collaboration.
Many researchers here at the center, they're not doing all the work that they're doing in the lab. They reached out to endemic countries such as Africa, in Sudan, in Ethiopia. They actually work in the field trying to tackle the real clinical aspect of diseases in the place where those diseases are actually being a burden.
One of the center's first forays into collaborative research was a decade-long program between researchers at the Kuvin Center and their counterparts at Ain Shams University in Cairo. This US-funded initiative began in the early 1980s, and the project focused on serious infectious diseases that cause disability and death.
Sandy Kuvin had tremendous vision, and he saw us as much bigger than we were. He headed off to Egypt, and he found each minister, had them all sign letters of intent on how cooperation with Israel had to be in the future to make peace.
In the late 1990s, the Kuvin Center again transcended borders in the Middle East through a cooperative program with Palestinian scientists at Al-Quds University in Jerusalem, researching leishmaniasis, which is a group of diseases transmitted by sandflies causing fever, skin lesions, and organ failure. In 2009, the Bill and Melinda Gates Foundation awarded the Kuvin Center a large grant to perform fieldwork and research on leishmaniasis in Ethiopia and other countries. In addition to COVID, many infectious and tropical diseases continues to pose threats to Israel, the region, and the entire world. The Kuvin Center remains dedicated to working with global colleagues to understand these diseases and eradicate them. Malaria, for example, continues to plague many countries with more than 200 million cases per year, leading to 400,000 deaths annually. Young children comprise more than half of these deaths. Every day, the Kuvin Center researchers make strides in better understanding malaria and other deadly diseases, which will undoubtedly lead to improved therapies.
Since it was established, the Kuvin Center has been engaged in groundbreaking research in understanding infectious disease and infectious disease epidemiology, modes of transmission, and methods of prevention. The work that they do will continue to save the lives of millions of children and adults across the globe.
Thank you to all of you for your most generous support of the Kuvin Center. Through international collaborative science, the Kuvin Center is helping the Hebrew University to spread compassion and goodwill and to bring the world closer together through science. Hello, everyone. I'm Patty Glazer, a partner at the law firm Glazer Weil in Los Angeles, and I'm proud to be a co-chair, one of several, of today's events, and a member of the American Friends of Hebrew University's National Board, Vice Chair of the Western Regional Board, and a member of the Board of Governors of Hebrew University. If there is a silver lining to be found in the tragedy of the COVID-19 pandemic, it may be that our shared experience has helped bring us closer together. Driven by both sympathy and empathy, citizens from around the world, from New York to LA, and from Italy to Israel, all struggling with the pandemic themselves. All of those people have reached out to help in many ways. In the midst of this global threat, we've seen the borders and cultural distinctions that divide us diminished as the world's priority to help with basic needs and to save lives took on a sense of urgency. Our panel today will be moderated by the acclaimed journalist Wolf Blitzer, the anchor of CNN's The Situation Room, and I'm proud to say a Hebrew University Rothberg International School alumnus. Today's panel will examine the lessons learned from the pandemic and their impact moving forward. Please join me in welcoming Wolf and our panelists. Dr. Ran Balicer, Chief Innovation Officer, Clalit Health Services and Founding Director of Clalit Research Institute. Dr. Dorit Nitzan of the World Health Organization and Israeli Ministry of Health Coronavirus Advisory Committee. Professor Roderick King, MD, MPH, Director of the MD, MPH program, University of Miami, who has had his students go to Israel to study at the Kuvin Center. And one of today's honorees, Dr. Leonard Schleifer, co-founder and CEO of Regeneron. Wolf, thank you so much from all of us for hosting today's discussion.
Thank you very much. And as I always like to say, I'm Wolf Blitzer, and you're in the Situation Room, or in this particular case, you're in the Situation Zoom. Thank you once again. This is going to be a really terrific panel. We have 4 real genius guests who can help us better appreciate what all of us have gone through over the past year and a few months, and look forward what we might anticipate in the years to come. Global infectious diseases, lessons learned from COVID and beyond. That's our subject for today, and our 4 panelists are really amazing. And as everyone knows, COVID is really, it's been a once in a century event for all of us. We didn't know what to expect in many aspects. We still aren't 100% sure what is down the road. It's a very, very connected world we all live in. What happens in one part of the world has a tremendous impact on the rest of us all over the world. Let me start with Dr. Schleifer. Dr. Schleifer, what have we learned over the past 14, 15 months from COVID as we address the issue of infectious diseases down the road?
Right. Thanks, Wolf. And by the way, I just want to say, in this pandemic speed world we've lived in, I still found enough time to tune in and listen to you. And it was very moving for me to hear you remember the people who we lost to COVID, and very motivating that every life mattered. And I think what we learned over the last almost a year and a half, not quite, is that we were woefully unprepared. I know that I went about 4 or 5 years ago to our government saying we needed to prepare for a pandemic. Others did it, but somehow it just never got done. And I think if we've learned anything, if and when we get through this, and we will get through it, we have got to be prepared for the next one, because it will come, and it probably will come a lot sooner than 100 years. So preparation is a key thing we must focus on.
And how do you see it, Dr. Boliser?
I fully agree. Thank you. It's really a privilege to be with you this evening. I do think that the main thing that we've learned is that we must have a lot of modesty when we approach these types of events. We started off with some expectations about how long it will take us to understand the basic modalities of the virus, the fatality, the infectivity, the differential between the groups, and actually it took us many more months than we expected. And whenever we thought we figured it out, it went and changed over again. And I don't think we've seen the last of it yet. So I think that modesty, understanding that when men versus virus, there's always another turn of a curve that's coming on just in front of us, is something that we need to keep in our minds before we feel safe and that we're in a safe harbor. I don't think we're there yet.
Yeah, I think you're absolutely right. Dr. Nitzan, you have a very unique perspective as well. Where do you see this moving?
Thank you, Wolf. I'm honored to be here, but I can only add to the previous speakers. And to add to it, I think that what I've learned and we have learned is that humanity is one, that we are connected, that we want to be together, that it's very hard to get us apart, and that trust is a real big issue. So preparedness has to look at the people and be people-centered.
That's obviously so smart. Dr. King, what about you?
Yeah, it's a great question, Wolf. I think what I took away from this, and hopefully everyone took away, is that public health matters. I think there was a huge underestimation of the impact of public health in staying healthy every day. And this pandemic really showed us that public health in collaboration with science is the only way that we can keep people safe and protected globally, not even just in our communities.
How do we move forward, Dr. Schleifer, with potentially increasing infectious threats out there? How do we move forward, learn the lessons that we've learned so far, and try to deal with these problems down the road?
Well, I think, Wolf, we have to recognize one thing, that science needs to operate the way science does. And we have to remove that political overhang over science. Science, doesn't usually make compromises. Some people may say the world is flat. Some people may say it's round. We don't compromise and say it's oval. Politicians may compromise, but science needs truths. And so I think the way we have to operate is we have to let science lead. If we let politics lead, we will distort the science and we will wind up with an oval world.
You agree, Dr. King?
Yes, absolutely. I think, the big takeaway for us is what happens when you mix science, public health, and politics. And the truth is, as the previous mentioned, that, science is yes or no, it's black or white. And when you start to mix those multiple different factors together, you get these compromises that put the lives of people in jeopardy. And that's exactly what we're seeing around the world.
Dr. Nitzan, the lessons learned from Israel's experience in dealing with COVID can and should be shared around the world. What are some of the main lessons that the Israeli experience could share?
Yes, I call it, Wolf, I call it the overseas. It's the C, the big C's. And this is actually a command, control, coordination, communication, and very important, community engagement. So I think when you have an organized system, indeed prepared for other emergencies as we are faced with now, but still, helping us to, or helping Israel to move forward in regards to fighting a virus.
And while I have you, Dr. Schleifer, I know that you've really been involved in this on a day-to-day basis with the treatments and potentially the vaccines and the cures. What have been, from your perspective, the main ingredients for success in our dealing here in the United States with COVID? Clearly, warp speed and the creation of these vaccines were so important.
Yeah, certainly that was important, Wolf, but that's sort of like the flower on the tree. You have to plant that tree, and that tree is really comes from the seed of innovation. And if we are unwilling to invest in innovation, to reward innovation, we're really not going to be successful. I know there's a lot of discussion and controversy whether people's patents should be opened up to the rest of the world and whether that would be a good thing. I would remind people what President Lincoln said about the patent system. Patents provide the fuel of interest to the fire of genius. The fuel of interest to the fire of genius. I think we've seen that countries like the United States that is willing to invest in innovation, willing to reward innovation, has a reservoir of this where these great treatments, cures, vaccines, public health measures can rapidly bear the fruit. But it's a long, long time ago that those seeds get planted by rewarding innovation.
Dr. King, what have been the main achievements that we've had over the past year plus in dealing with COVID-19 and the main failures?
Yeah, well, I think as mentioned by the previous speaker, the main achievement has been the rapid speed of the vaccine development. I mean, historically, that we have never developed vaccines that quickly, much less multiple versions of a vaccine within a year. I think also what was the great success is that as a country, we were sharing data across state lines. So you can kind of watch the pattern of how the disease was beginning to unfold in California versus New York and Wisconsin or Texas and Florida. So that kind of sharing and commonality of data was helpful to kind of know where the disease was going, because with any pandemic, it can be a regional kind of focus or epicenter. I think the challenges are when we got to the issues around the equity, when we started seeing disparate incomes and disparate impacts, on certain populations. And I think that probably is our biggest shortfall, Wolf, which was we did not have the data to get to a more granular level to kind of say what was happening in certain communities. And to this day, we can kind of get a broad picture of big areas of states or cities. But when it came down to neighborhoods where there might be small super outbreaks that were happening and a higher mortality rate, we had no idea. So I think our challenge is to kind of take our data collection process and really bring it down to a more granular level so that we can understand how patterns of disease are spreading and how best to support people. Not any different than how we target folks for election and voting patterns.
That's an excellent point. Dr. Nitzan, I want you to elaborate, and given your international experience.
Yes, I can just really enforce and thank you, Dr. King, for what you just said, because what we saw is that better data better analytics, really lead to better decision making. And we are building on that for the better future. We know that we need now to look at the communities, at different aspects, and not only health per se. Many times it has to do with social and life and the way people live. And we need to understand the full picture and incorporate into medicine, into epidemiology, also people from anthropology and other professions, so that we will know much better what to be done.
And Dr. Nitzan, let me just get you to elaborate a little bit because of your international World Health Organization experience. What lessons have we learned in dealing with COVID-19 that we should be able to appreciate in dealing with other communicable diseases, let's say like malaria, which is still out there?
Yes, we learned that that we cannot think that things happen there, far away from us, that it's not, because what we saw in COVID, just to remind us, the first region in the world after China, the virus hopped into France, to Italy, to Germany, and we that were thinking always about other side of the world had to face it and really get to work with the ministries that were not, as you said, had to really get better prepared. So what we see now that we have to take very seriously communicable diseases, to look at One Health. And this is one aspect that we are really promoting, looking at human life, human health, environment, and animal health. We are all connected, and we have to pay much more attention into this.
Yeah, we certainly do. Dr. Schleifer, you and your company Regeneron have been doing really amazing work in dealing with the treatment of people who are positive for COVID-19, and you've saved by this treatment a lot of lives. Give us a little background on that, if you don't mind, and give us your assessment, what you've learned, how that can be translated in dealing with other diseases and new variants, God forbid, that could potentially be very deadly as well, variants of the COVID-19 that we've all gotten adjusted to.
Yeah, sure. I think that what you need what we would say is the 1-minute primer on the immune system. What your body does when it's faced with a foreign invader like a virus is it has this random generator, which can generate these proteins called antibodies, and these antibodies can then surround and destroy the virus. The problem is it's a very complicated process, even with billions of years of evolution, and it takes several weeks before your body can react to this invader. And so we realized that the long-term solution would be a vaccine, so your body already is prepared so that it can respond to it. But before there's a vaccine, we could actually give people antibodies, sort of like an immune system in a vial, in a medicine. And this wasn't a profound insight, because the first Nobel Prize ever was given out a couple of 100 years ago for passive immunity for diphtheria toxin. And it's known for cowpox could affect the treatment of smallpox through passive immunity. And we actually showed that you could cure people with Ebola by making antibodies. How did we all do that? We had these special mice that George Yancopoulos had dreamed up and made and spent decades perfecting, where you could make the mice, immunize them with the virus, and make a human antibody. This human antibody, remarkably enough, could prevent you from either dying or going into the hospital, reduce that risk by 70%. 70% is a gargantuan effect in biology and medicines. And we were able to do that because we copied the immune system. And I think we're going to have to continue to do that, a two-pronged approach. But the sad thing for me is many lives, as you said, we've saved with this medicine. It's the lives that could have been saved. And there was a very slow deployment, despite the fact that the drug is free. So you can't blame it on the greedy drug companies. The drug is actually free. The drug is endorsed by the NIH, although they took a long time to do it. It's authorized by the FDA. They did it really quickly. It's still not accepted yet, even though the data are overwhelming, almost by some skepticism. And we have to overcome that. We have to overcome it for vaccines, or all the great work won't do any good unless we can get people to treat it. And that's what we should be educating people about as we get ready for the next one that comes.
Yeah, well, that's great advice. And thank you for everything you and Regeneron have been doing, because as I said, you've been saving a lot of lives of people who come down with COVID, especially the most vulnerable, the elderly, and people with underlying health conditions. Dr. Bolliser, what lessons, from your perspective, are the main lessons people around the world should gather from what you in Israel had to deal with and how you dealt with it?
So I think that several characteristics of the Israeli healthcare system were really important in mitigating this event. The first one is universal healthcare system. The fact that we have universal access to everyone with a community-focused proactive care system was really helpful in starting almost de novo hundreds of vaccination clinics that were able to vaccinate almost 50% of the population within a matter of a few weeks. So I think that that's a key point. The second one is that you cannot reach these levels of immunizations if you don't find a way to deal with vaccine hesitancy. And one of the things we've done is a lot of respectful conversations. Sorry, here it goes again. Sorry.
We hear the siren. Go ahead, go downstairs, go to the bunker. We will be in touch with you. But as we've been saying, this is what's been going on these past couple of days in Israel with the rockets coming in. And so it's not a good situation by any means. Dr. King, we're getting close to the end, but just wrap this up for us. And I want Dr. Nitzan and Dr. Schleifer as well. Give us some final thoughts on what people who are watching us right now need to know as we go forward, especially those like you and me, I assume all of us, who are fully vaccinated. What should we be most concerned about right now? I personally am most concerned about new variants that may evolve and may develop that potentially the Moderna or the Pfizer or the Johnson & Johnson vaccines won't necessarily deal all that effectively with.
Yeah, I think you've hit the nail on the head as one of the key issues, Wolf, which is that we're not out of the woods yet, right? It's natural for viruses to mutate. And so as expected, COVID is mutating. So far, the vaccines that we've developed seem to have good protection against some of the variants, but we have to be vigilant and keep monitoring and checking to make sure that any new variants that come about are protected. But, we also need to think about this as a long game. What I try to tell some family members, because I don't know about you, Wolf, but I still have family members that aren't vaccinated, and I'm still trying to convince them. So there's still millions of folks that have not been vaccinated that we need to convince to get vaccinated. And there are still millions of folks globally that we need to make sure that they get access to this vaccine, because as we heard earlier, this can easily spread around the world again. And I think as I try to explain to folks, I want them to kind of think of it as not as a black and white on and off COVID or no COVID, but to think of this almost like a flu season, right? We've never gotten rid of flu, right? Every year there's a variation of flu and we have to get a new flu vaccine. So there's a very good likely, and we've heard this from Dr. Fauci, that we may have to see these cycles, or we may see these cycles of COVID that come around every year, and we may have to have repeated vaccination. So I just want folks to know that I'm glad folks have gotten vaccinated and they're safe, to continue the precautions because we're still not in the woods yet, but to think about this as a long game that we have to continue to try to keep ourselves and our family protected.
Well said. All of us get flu shots every year. If we had to get a COVID shot every year, it's not the end of the world. Ready to get a COVID shot once a year as well. Because coming down with COVID is not good. Dr. Nitzan, give us some final thoughts from your very unique international perspective.
Yes, I'm worried and thinking a lot about inequities, about the fact that no one is safe until everyone is safe, and the fact that part of the world has no access to vaccines. And that part, I think the richer parts of the world have to give a hand, to give a shoulder, and to help everyone to get access to those vaccines. Also worried from the next pandemic, and this would come, and if we will not learn our lessons now, we might find ourselves in a horrible situation. And the last thing, Wolf, I think that we have to see that, to understand that there are so many little enemies out there looking for us and to reach us and to get us. We should just join hands and find the way to make peace with this crisis. So thank you.
Thank you very much, Dr. Nitzan. Dr. Schleifer, and congratulations that the Hebrew University in Jerusalem is honoring you. It's such a well-deserved honor, and we're so grateful and appreciative of all that you and your colleagues do. But go ahead, give us a final thought.
Sure. Well, I think you're right that those of us who are vaccinated and respond will probably do fine. We may have to get a booster of some sort. I'm optimistic about that. But I think the virus may very well be around for a while. And we are going to have to face up to the fact that there are millions of people in the United States alone, and therefore tens of millions of people around the world, that through no fault of their own, who get vaccinated but don't respond to the vaccine. They may be people who've had an organ transplant. They may be people who have an immunosuppressive disease, an immunosuppressive drug. There are millions of these people. So we have to continue to invest. We have to make sure drugs like ours are available for these people, that they're accessible, and that they're accessible for people around the world. As I said, my plea is don't destroy the innovation that has produced these wonderful successes. The biopharmaceutical industry has risen to the occasion. These successes came from industry. We can't forget that. The evil industry, which there are some evil people in our industry, but the industry is not so evil, and it has produced these great life-saving effects. And I hope people will remember that and not destroy the goose, so to speak.
Dr. Schleifer, thank you so much. And once again, congratulations to you, a well-deserved honor. Dr. Nitzan, thank you for all that you do. We are grateful to you. Dr. King, grateful to you as well. Dr. Balaser, unfortunately, still underground right now because the sirens have gone off where he is in Israel. We wish him and everyone, obviously, only the very best. And we want to thank the American Friends of the Hebrew University for all that the Hebrew University in Jerusalem does. I'm very proud that between my sophomore and junior years, as an undergraduate at the State University of New York at Buffalo, I spent 2 months at the Hebrew University that summer, 2 months in a program sponsored by the State University of New York at Oneonta. And it was a terrific 2 months. First time I had been to the Hebrew University, and you guys do amazing, amazing work. So on behalf of all of us, thanks for what you're doing, and thanks for joining us today.
Thank you, Wolf and panelists, for a very interesting discussion. On behalf of the American Friends of Hebrew University, we are proud to acknowledge your generous support on the Scroll of Honor, and then to bring you to the Hebrew University campuses with our virtual journal. Congratulations to our Titans, Drs. Anthony Fauci, Leonard Schleifer, and George Yancopoulos. Sincere thanks to our co-chairs, Stanley Bergman, Jeffrey Kuvin, Patricia Glazer, Sam Moody, and Kenneth Stein, the Hebrew University leadership, and the AFHU and Hebrew University team that were responsible for producing Titans of Global Health. Your most generous donation will fund Hebrew University's Kuvin Center for the Study of Infectious and Tropical Diseases and the mission of American Friends. We hope you enjoyed this program and wish you and yours good health and, of course, peace.